I would like to welcome our moderator, Ms. Meeta Patel, on the stage over here.
Good evening, ladies and gentlemen. Thank you so much for your patience. I know the time is little pausing and everybody is in a hurry. So we'll quickly start with this panel. I'll quickly introduce the panelists on stage. I would like to welcome Neeraj sir again on this dais. He is Apollo Hospital COO. I would like to invite Dr. Geetika Madan Patel ma'am, Parul Sevashram Hospital. Mr. Dheeraj Khatore from AACI, Dr. Vikram Patel from Kailash Cancer Hospital, Muni Sevashram, Neha Lal ma'am, Adani GM Projects, Dr. Parth Desai sir from KD Hospitals. While all the eminent panelists are just welcoming. Thank you so much for taking out time, dear panelists, and having you here. So the very interesting topic, it's future trends in healthcare. That's what we've been talking about for the entire, day. I'm sure everybody is now aware, enlightened, क्या future trends होने चाहिए, क्या technology होनी चाहिए, Ayushman Bharat, even for the insurance part and everything. But then these people have their own ideas because they have been working with hospitals or they have their hospitals who have been pioneers in all these future trends in healthcare, including Apollo, KD, Adani for that matter, and Mr. Dheeraj is coming from, all the way from UAE to enlighten us for the accreditation and how it can help, for the entire process. So I'll not wasting much time and I'll start asking questions. All right, so my first question is to Dr. Parth from KD. What strategies, can be implemented to make advanced healthcare treatments more affordable and accessible to all sections of society, ensuring that these services are available in both major cities and rural areas?
Thank you. At the outset, I would like to thank Medigence for organizing such a wonderful conference and bringing us all together and giving a platform to exchange ideas on the topics of healthcare. So the question goes as how each and every nook and corner of the country can have advanced healthcare, and that too which is at an affordable rates. To be very honest, throughout the day also I heard the deliberations about it. In our country, probably when we compare to other countries of the globe, in terms of quality, we are nearing to obviously one of the best, while the cost that we deliver that quality is probably 1/10 of the Western counterparts. So going more affordable or now becoming more cost effective is definitely a burden that we all take in matters which can compromise quality. So what I would like to see this thing is into three phases. One is government initiatives, primarily increasing obviously GDP, which we all are talking through different forums that currently we are nearing to 2.5% of our GDP while advanced countries are to 18%. So how we increase investment in all the nook and corners of the country and see to it that bad allocation across the country is going to a uniform manner. Second is human resource training, again, which we have been talking about, that how do we get quality doctors and nurses and paramedics into the system, and it's just not numbers I'm talking about, but it's the quality of this human resource which does matter. And then harnessing technologies of obviously telemedicine, tele-ICUs, mobile clinics, so that flavor of an advanced healthcare is being felt across the country and not limited to the cities. So that is my point of view on this question.
Thank you so much, Dr. Parth. The same question I would like to ask to Dr. Vikram sir as well, because Muni Sevashram and Kailash Cancer Hospital has been a tremendous pioneer in all these activities. Please, sir.
Thank you, and Jai Shri Krishna.
Jai Shri Krishna.
As we see nowadays, hospital is a very costly affair. So, and in major cities, the cost of the development and land is so huge. I would prefer that good hospitals should now start in some remote areas, at least 30, 35, 40 kilometers away from the major city. Because 35 kilometers to travel nowadays is easy for anybody. But to get that much space in a city It's a damn costly, and that will make the healthcare very costly also. Another thing, if it is in the such remote area, the villagers, they can access it very easily. And of course, healthcare we should consider as a right of the person rather than it's some privilege or advantage. So it should be available across the society. We have very good healthcare mechanism available in India, but it is available to only few select people who can afford it. So there the government and NGOs should come forward to establish the latest healthcare facility which they can service the lower socioeconomic strata as well. As far as medical personnel is concerned, I know my experience that if you provide them good honor and freedom in their professionalism, they are happy to work with even such NGOs also. Okay? They want to give their service very well. So nowadays the facilities should, rather than in the middle of city, it should be from away, somewhere where the land is cheap, construction cost is cheap, overheads are less compared to a city, taxes and other things. And subordinate staff you can get very easily from the rural area, except the experts and technical people. So that should be the model of development, and government and NGOs should come forward rather than the multidisciplinary corporate hospitals where main OAM is to earn. Okay? So there is a class which they can cater very well, no problem. But there is another class where government and NGOs should come forward and make facility available to such people. That's what we were trying for last 35, 40 years. Thank you.
Excellent, excellent, sir. Thank you so much for your insights, and this definitely is going to benefit the people who are listening, My next question is for Neha Lal. What preventive healthcare initiatives should we prioritize to reduce the disease burden and improve overall public health? And how can we enhance its existing infrastructure to support these initiatives?
Hi, Meeta. Actually, in my opinion, healthcare is two words. One is health, one is care. So it is always health plus care. So care part is already given to the hospital to take care of, because whenever any individual gets ill and they look for the treatment and care, they rush to the hospital. And that is what the hospital is all about. Hospital means hospitalization. And I think preventive aspect more coming from the aspect of health. And I would say, in my personal opinion, it is about having your self-awareness. How are you as an individual? Are you healthy or not? I mean, we all go to gym, we all work out just to stay healthy, just to stay fit. Talking about the rural health population, the irony is that rural area and rural population do not have accessibility and affordability to go to the large hospital, which is essentially located at the Tier 1, Tier 2 cities. And the Tier 3 cities and Tier 3 rural areas are really suffering off. So I would buy that point which you have just mentioned, that if you go away from the city, let's say 30, 40, 50 kilometers, and we try and assess that market, we try to cultivate some sort of hospitals there wherein accessibility at least addressed, not about the affordability. If we talk about the affordability, I would urge PMJY, with the way in which the PMJY is thriving in state of Gujarat, 10 lakh of sum insured is given to the BPL and above, which is really, really an awesome move. I would look forward to have some similar kind of model for the OPD as well. If the PMJY comes up for the OPD model, where such a population get covered with OPD consultation, fewer diagnostic and few medicines, I think that will cover most of the part as far as we talk about the preventive healthcare. So preventive healthcare, in my opinion, is nothing but the self-discipline and self-awareness. That awareness will come. It will take many years to come, but I think we as an industry leader can think about some strategies, some feasible solutions to address it. That is my take. Thank you.
Great. Thank you so much, Neha ma'am, for this insight. Geetika ma'am, Parul University has been always into, expansion in terms of technology, in terms of using the technology to this best affordability also, So how can we harness its pool of skilled healthcare professionals to improve service delivery and patient outcomes, and what training programs are needed to prepare healthcare workers for the future trends?
Thank you, Meeta, for having me here. It's a wonderful platform you have created. So as we are talking about the overall concept of the panel is about future of healthcare. So and skilled workforce is what you have been asking me. So I would like to bring this to notice that in the next 5 years, there is going to be a transformative change which is going to happen because of the number of doctors that are going to pass out in, say, for example, 2030, if I talk about it. So nearly 50,000 more doctors will be coming out of the medical colleges as per the current statistics. And still there is a lot of gap between the postgraduate seats and the undergraduate seats. So what we need to understand is that these many doctors, once they are coming out of the medical colleges, would be ready and available to serve in the peripheral areas, because definitely there is not much space in the cities to accommodate them now. Now coming to the productivity which these doctors can bring into the areas, in the taluka places or into the rural areas, wherever they serve, it's extremely important, and it will depend upon the skills that they are possessing. Because we all know that healthcare works in an integrated manner in a team, right? It's never possible that a doctor can go alone in a health center and start working without a proper nurse, without a proper biomed engineer, without a proper OT assistant and perform there. So it has become extremely crucial at this stage of time to realize the need for skilling the doctors as well as the paramedics and the nurses appropriately, so that these teams, once they are stationed, once we have sufficient number of doctors and they are ready, available to perform in the peripheries, are appropriately skilled. Now how do we do this is, of course, there is a lot of change which is coming in medical education into the medical colleges for making sure that a graduate is equipped with the correct skills. However, on the top of it, we also need to work on the skilling of the nurses and the paramedics, because very recently, talking about an example, we recently started 3 peripheral centers in taluka areas. Now I could find a good doctor to work there. However, it has been extremely challenging to find the correct nurses and paramedics to support that doctor. We do not have biomedical engineers. So there is a lot of mobilization from the cities which has to happen for that purpose. If I want to operate a patient in a periphery, it's very difficult to run appropriately an operation theatre in that periphery. So that is the reason why, till we have these doctors coming out, 50,000 additional doctors coming out of the colleges, we work on the skilling of both the doctors as well as the nurses and paramedics, continuing education programs, having more of training institutions, like we have SIHFWs in the state which train the in-service nurses. We need more of them at district and taluka places, so that we can have continuing trainings. Newer technologies coming every year. It's very important to train the paramedics and nurses also in these technologies. So more of in-service and continuing training institutes will be required in the coming time. And diagnosis, as we all know, is a very important aspect of healthcare. Without diagnosis, we cannot go ahead. So more research on point of care diagnosis, which is the current, it's a lot is being done in that area. So we need more of research into point of care diagnosis, so that in rural areas, we do not burden them with high cost investigation and test, and we can have simpler diagnosis mechanisms, so that the doctors and the integrated team which is working can have at least the basic specialty, can offer at least the basic specialty care. For example, if we do not manufacture certain equipments in India, like if we do not manufacture cath labs, it's never possible that we'll be able to reach to the peripheries with the cardiology, interventions and all. So it will take a lot of time to go to that level. However, the basic point of care diagnosis is very much the need of the hour for research, which we need so that we can have the correct kind of care being given in these areas. Thank you.
Thank you. Thank you so much for your insights, Dr. Geetika ma'am. Neeraj sir, my question to you would be how we can effectively utilize the public-private partnerships to enhance its healthcare system, and can you provide examples of successful partnerships that could serve as models for other regions?
Yeah, actually few of the government of Gujarat initiative under the public-private partnership. One of the critical care consultant is there, I don't know whether he is here or not, Dr. Raj Raval. He is head of the critical care at Sal Hospital. So he has done a partnership with government of Gujarat. He is managing the critical care beds for 6 of the districts of Gujarat. So because these places, they don't have doctors, so he is managing through a central monitoring system which is based in South Bhopal. So I think government of Gujarat, I think I've seen one of the few government who is proactive, but somehow, the reach is very small. Like say for example, if all the tier 2 and tier 3 town is managed properly through these public-private partnership. Though government talk a lot, but when you travel to these tier 2 and tier 3 cities, you don't find this kind of collaboration. He is now moving away from Gujarat and he is contacting MP government as well as the Rajasthan government. So I think where the terrain is difficult, so I think if we can use these platform under public-private partnership, the project is there and government has given. Like say for example, Karnataka government has given this public-private partnership to some of the best children hospital in Bangalore. So what they used to do, there is a perinatal workshop which they used to do with the main city and connecting Shimoga, Dharwad and all these places. So examples are there. I think we have to talk about these example in this forum so that we can request the government to become more open. I think health minister was here, so we can talk to him and talk about if we can manage these kind of patient through this platform, because whatever you do, like everybody in this forum is talking about 35 kilometers away from the center, but it will take time. The hospitals and healthcare center, tertiary care center, it is very, very difficult to replicate in these cities. However, you can create a primary center or secondary healthcare center. You need to use technology under the PPP model, which government, like government of Gujarat, who is very aggressive, can take lead into that.
Thank you so much, sir. Just we are running out of time. A quick question to Dheeraj ji, one last question. With the growing use of digital health technologies, how can we ensure the privacy and security of patient data, and what opportunities and challenges do big data and health analytics present for the state's healthcare system?
Thank you for that question, and thank you, Meeta, for this wonderful event. I just came for you from UAE, so one whole day met with the stalwarts. Coming to the question that is secondary to what I do, we do accreditations of hospitals. Last 2 years I've been working with different hospitals and saw that digital health is growing everywhere. And what digital health is just a term, but it's very complex. It's itself a next stream of studies, I believe. And it's just not AI, we use this term everywhere. But I believe digital health is next 10 years to 20 years what is going to have. For example, what Dr. Neeraj was showing is part of digital health, but it's more extensive in different countries. In UAE, we have interoperability. You can go to any hospital, your data is transferred. US has done that. Most of the developed countries have that in place. I appreciate ABDM, what they're trying to do. It's a huge step where we have seen the advantages in different countries, how easy it's for the x-rays to move, the DICOM image, everything. You know, you cannot say, I'm lacking anything. You go anywhere, you get the same treatment. Big data, I think we are still far from what we are seeing right now. But Gujarat being a pharmacy state, I think big data can make difference in clinical trials. That's what I bring, that you can do clinical trials faster and get the treatment done. Again, coming to digital therapeutics, which is part of digital health, is based on pharmacy. So it's pharmacy and hospitals who work together to bring the digital therapeutics, which is, I believe everybody is in mobile since morning, almost 8 hours. You can still do monitoring of yourselves in the mobile, no need for hardware. We can do clinical decision support system. Your symptoms will be checked by the machines and it can tell you what's going to happen to you. It can be integrated to electronic medical record. It can alert your systems. So it's huge. And challenges, I will say cybersecurity is the biggest thing. Again, I did some data. Everybody is hacked morning and day and night. We all lose money. I'm sure everybody has lost some, including whatever the things that we think. So as a patient and the Data Protection Act, which is there in India right now, I still believe it's not much read by the hospitals. The fine is 250 CR, which is not an easy thing if we want to lose that. So cybersecurity and making the patient confident that my data is protected is important. So I think I will stop there. Thank you.
So thank you so much, Dheeraj. I know the time is a little pausing. And Lipi, I would request you to please come on stage. For the thing. And thank you so much, everyone. Thank you so much for all the panelists for your precious time, and we look forward to your insights every now and then. Thank you so much.
Thank you so much, and following the tradition, I would now request Keshav Bhalla from Santwals and Kushagra Jaina from Armacell to please join us and present a token of gratitude to our panelist over here. We would like to present a token of gratitude to Dr. Geetika Patel. Neeraj Khatore. Dr. Parth Desai. Dr. Vikram Patel. And our moderator, Meeta Patel. Thank you so much, and thank you to all our panelists present over here. We'll have a group picture. Meeta ma'am, we'll have a group picture.